Why should healthcare professionals prioritize HIPAA compliance in email communications with patients? This question merits a thoughtful response. HIPAA compliance isn't just a box to check off. It's a responsibility to protect our patients' privacy and confidentiality. When we communicate with patients via email, we're dealing with sensitive data. HIPAA compliance ensures we handle that data with the utmost care, but there's more. The stakes are high. Non-compliance doesn't just risk breaches of trust, it can lead to legal penalties that can run into millions of dollars. It could also tarnish your professional reputation, a blow that can be even more devastating than a fine. HIPAA compliance in email communications isn't just about following rules, it's about safeguarding our patients, protecting our practice, and upholding the high ethical standards of the healthcare profession. As we see, HIPAA compliance is paramount, especially when dealing with patient information via email. What are the best practices for secure communication platforms? This is a question that sets the stage for our discussion today. When communicating sensitive patient information, it's vital to utilize encrypted email services or secure patient portals. These tools are provided by platforms that are compliant with the Health Insurance Portability and Accountability Act, or HIPAA. You see, these systems don't just send your messages from point A to point B. They actually encrypt the information within the messages. Think of it as wrapping your message in a secure envelope that can only be opened by the intended recipient. This ensures that patient information remains confidential and secure throughout its journey. This is not just a good practice, it's a necessary one. Ensuring the confidentiality of patient information is at the heart of HIPAA regulations. Utilizing secure platforms is a crucial first step in maintaining HIPAA compliance in email communications. So let's get started on the right foot, shall we? How do we ensure patient consent and use secure email addresses? This question forms the foundation of our discussion in this section. When we talk about patient consent, we're referring to getting an explicit agreement from patients to communicate via email. This is not only a demonstration of respect for patient autonomy, but it's also a legal requirement under HIPAA. Before any email exchange involving health-related information, it's crucial to have documented proof that the patient has allowed this form of communication. This consent can be acquired during initial patient intake or at any subsequent appointments. Now let's steer our discussion towards the importance of secure and verified email addresses. We live in a digital age where security breaches are unfortunately all too common. In the context of patient-doctor communication, it's paramount to ensure that both sender and recipient email addresses are verified and secure. This is not just about protecting sensitive health information, but it's also about maintaining the trust that patients place in their healthcare providers. In addition, one of the biggest threats to patient privacy comes from a simple mistake: sending an email to the wrong recipient. It's a common error, but with potentially devastating consequences if sensitive medical information is involved. To mitigate this risk, healthcare providers must implement measures to prevent accidental sharing of patient data with incorrect email addresses. For instance, some email platforms offer features that require users to confirm the recipient's email address before sending an email containing sensitive information. This simple extra step can make a big difference in protecting patient privacy. But what if a breach does occur, despite all precautions? It's important to have a plan in place. Healthcare providers should have a procedure for reporting and managing any breaches of patient information, in line with HIPAA requirements. In conclusion, patient consent and secure email addresses are not just good practices, they're integral to HIPAA-compliant email communication. They help protect patient data, uphold patient trust, and maintain the integrity of our healthcare systems. Remember, patient consent and secure email addresses are integral to HIPAA-compliant email communication. What should we avoid when writing emails to patients? Now that's a question that deserves our full attention. When it comes to email communication, it's essential to tread lightly. Sensitive information such as medical details should never find their way into the subject line or body of the email. This is a safety net, a way to ensure patient data remains confidential. So how do we convey necessary information without crossing the line? The answer is simple: code words and generic language. By using generic terms or coded language, we can communicate effectively without risking patient privacy. It's also crucial to advise our patients to employ the same strategy. They should be guided to avoid sharing sensitive information in their replies. Remember, the goal is not just to communicate, but to do so in a manner that respects and protects the privacy of our patients. Keeping emails generic and coded helps maintain patient privacy and HIPAA compliance. What role do staff guidelines and risk assessments play in HIPAA compliance? Now, that's a question worth exploring. Staff guidelines, for one, are the compass directing your team's journey through the maze of email communication. They establish the do's and don'ts, the hows and whys of handling sensitive patient data. You see, every email sent, received, or even merely opened is a potential doorway to a data breach. It's crucial that your staff knows how to navigate these doorways without tripping any alarms. This means training them on the proper protocols for sending and receiving sensitive information via email. It means making sure they understand the importance of using encrypted services, of verifying email addresses, and of avoiding the inclusion of sensitive information. But establishing guidelines is only half the battle. Ensuring they're followed is equally important. That's where risk assessments come into play. Regular risk assessments are like a routine health checkup for your email communication system. They help you identify potential vulnerabilities, those weak spots that could, if left unattended, lead to a data breach. Imagine discovering that your emails aren't being encrypted properly, or that an unauthorized individual has been accessing patient information. These are serious issues that could have severe consequences. But by conducting routine risk assessments, you can catch these issues early on, before they become full-blown problems. And once you've identified a weakness, you can address it promptly, enhancing your security measures and shoring up your defenses. Risk assessments also serve another purpose. They show you where your staff might need additional training or support. Maybe they're struggling with the encryption process, or perhaps they're not verifying email addresses as thoroughly as they should be. By identifying these areas for improvement, you can provide targeted training and support, helping your staff to better adhere to your guidelines. Staff guidelines and regular risk assessments are key to maintaining a secure and HIPAA-compliant email communication system. They're the tools that help you navigate the maze of email communication, keeping your patients' data safe and secure, and keeping you on the right side of HIPAA compliance. How can we further enhance the security of email communications, you might ask? Well, it's all about control, authentication, and tracking. Let's begin with access control. To ensure that only authorized personnel have access to sensitive patient information, we must implement measures to control access. This could be as simple as setting up unique user accounts for each staff member, or as complex as using biometric authentication methods. The goal is to ensure that only designated individuals can access the information they need to do their jobs, while keeping unauthorized persons out. This not only protects patient information, but also helps to prevent accidental sharing of data. Next, we have two-factor authentication, a vital security measure that adds an extra layer of protection. Think of it as a double lock on a safe. The first lock is your usual password, and the second could be anything from a text message code sent to your phone, to a fingerprint scan, to a special key card. Two-factor authentication makes it significantly harder for unauthorized individuals to gain access to email accounts, thus providing an additional safeguard for sensitive patient information. Lastly, we need to talk about the importance of documenting and tracking communication. This doesn't just refer to keeping records of the emails we send and receive. It also involves monitoring who accesses these emails, when, and why. This documentation creates a trail of communication that aids in accountability and compliance auditing. It ensures we can trace any information breaches back to their source, and can also help us identify areas where our security might need tightening up. Remember, the goal of all these measures is to protect sensitive patient information. By controlling access, enabling two-factor authentication, and tracking communication, we significantly enhance the security of our email communications. So let's make these best practices standard in our email communication protocols. Because when it comes to patient information, every extra layer of security counts. Why is patient education important in email communication? The key to secure email communication is not just in the hands of healthcare professionals, but also patients. Patients need to understand the risks and benefits of email communication. They need to recognize that while emails can be a convenient way to receive health updates, they can also be a potential avenue for data breaches if not handled properly. Encouraging patients to use secure channels is crucial. They should be guided on how to identify and use encrypted email services or secure patient portals. This helps to ensure the confidentiality of their sensitive information. Additionally, patients should be taught how to safeguard their personal information in digital communication. Remind them not to share sensitive data in their replies and to use generic or coded language whenever possible. Educating patients not only empowers them, but also adds an extra layer of security to our email communication.